Hello, everyone. Thank you so much for coming. In the interest of time, we're going to go ahead and get started. My name is Dr. Erin Hennessy, and I'm a nurse practitioner at Blush Aesthetics. A little bit of background about me. I got my doctorate of nursing practice from Case Western Reserve University, and I have been a nurse for 20 years. That sounds really crazy, but it's the truth. In those 20 years, I've been working with pediatric patients, burn patients, trauma patients. Skin and the healing and improvement of skin is really a passion of mine. So today we're going to talk about broadband light and how it can help your skin and whether or not you might be a good candidate for it. So Forever Young Broadband Light is an apparatus, is a light treatment that we use that is on the Sciton Jewel platform, which is one of the lasers that we are blessed to have in our practice. This is one of the treatments that people really gravitate toward who have more browns and reds on their skin, whether that's age spots or broken blood vessels, if they have sun damage. Maybe they're just getting into taking care of their skin. They've maybe slightly abused it in the past with sun exposure and maybe smoking or poor diets, different things like that, and they're looking to improve their skin. For some folks with broadband light, they're utilizing it because they have acne or they have rosacea. And then there's a whole nother category of folks that use it to maintain the results that they have that we achieve with different treatments that we have, whether that's treatment through halo or profractional or our resurfacing. Once you have those treatments and you see that beautiful glowing skin, you really want to keep that. So broadband light is a wonderful way that we can maintain healthy skin of individuals who have gone through the process of improving it, or maybe they're young and they're youthful in their 20s and they want to stay that way. They want to keep their skin that way. They want to practice preventative maintenance. So what is it about youthful skin? When we look at someone's face, we can immediately tell pretty much which decade of life they're in. So when you look at the young lady on the left, you can tell she's in maybe her late teens into her 20s. She has most of the volume of her face at the top, and then it kind of tapers down. Her skin is taut. There's not laxity in it. And she doesn't have kind of that brown wearing of sun on the skin. So you can see she looks very youthful in this picture. The same person is pictured on the right-hand side of the screen, and you can tell that she's older. The sun reflects differently off of her skin. Her texture is different. She has that sun damage that's very apparent, and you can see some of that skin laxity and some of that volume moving in the southern direction. So beautiful skin is bright skin. When we think about how the light reflects off of skin, in a youthful person, it really reflects beautifully. In someone who's older, it gets a little muddled. And we see this in our before and after pictures of patients. So we will look at those coming up. So when we ask women around the world, what are you looking for from your skin? They want skin that looks and feels better. They want smoother texture. They want a more even tone. A lot of them tell us that they're covering up those tonal inconsistencies with makeup. They want more resilience to their skin. They want their skin to feel and act and look younger. They want fewer freckles and age spots on the skin, and they want to resolve any acne issues. We typically think of acne as something that afflicts teenagers, but to be very honest, we have a lot of patients that come to us that have acne into their third, fourth, fifth, and sixth decade of life still. So we want overall enhancement and improvement of our skin. So popular culture in the media, they're buzzing. There's a lot on, social media as far as Facebook and Instagram. We're taking pictures of ourselves. We're taking pictures of ourselves with our families. When you're applying for a job, someone is looking at your LinkedIn profile. So there is a lot more, I would say, facing of the community, of the public that we do on social media than there was in the past. So if you're applying for a job, someone may click on your LinkedIn site and see a headshot of you, see your resume, see your profile. And that's one of the ways that we communicate to other people, to people that we're just meeting, to our family, to our friends, to our coworkers. Your face is the first thing that they see. And so is in essence the first communication that you have with folks. You have to think about, what do you want your face to say? And I think that that's twofold. I think that the outer appearance of the skin communicates one thing, but also how you feel about yourself and how you feel about your skin says another. So if you're meeting someone for the first time and you're smiling and your eyes are smiling along with your mouth and you're confident and you're happy, that's going to come through. That really is going to show through in how you communicate. So let me introduce you to broadband light. BBL, or broadband light, introduces your skin to the power of light therapy. It addresses a lot of common skin concerns, such as brown spots, red spots, broken blood vessels, laxity. We can definitely, over time, make some structural changes in the skin. Certainly, if someone is in need of more of a texture reset, they have fine lines, wrinkles, we can do a series of broadband light therapies for that. Or sometimes we start with halo to get a reset correction of the skin and then maintain those results with broadband light. So this is light energy, similar to how the sun shines on the grass and the flowers and the trees and they grow. This is moving into your skin and changing and restructuring on a very cellular level how your skin acts so that it outwardly looks better. So the heat stimulates those cells to regenerate and restore skin to its natural beauty for a clearer, smoother, vibrant, more youthful looking appearance. There was a wonderful study at Stanford University, and I'm a bit of a science geek, so I love these studies, that found evidence that broadband light treatment promotes youthful skin on that molecular level. So there were over 1,000 gene expressions that were rejuvenated to act more like youthful skin, resulting in that decreased elastosis and more uniform collagen deposition. So, what does that mean? That means that the skin was restructuring itself and acting more like it did when you were in your 20s. This leads to improvements in fine lines and wrinkles, pigmentation, red spots, blood vessels, all of the things that make our skin appear aged. So how we choose which filter we would like to use on your skin depends on which area of the skin we want to work in. So for someone with acne, that's more superficial, and we're going to go ahead and put that 420 filter in. For someone who has pigment, we move along the line. For someone who has redness, for someone who has maybe cystic acne or darker skin, for someone who's looking for improvement in the appearance of additional hair follicles that they don't want to be on their upper lip, on their chin, on their jawline, or for our darker skin patients that are looking for rejuvenation. We want to avoid putting a lot of surface heat on that skin because it's very sensitive, and we don't want any type of darkening of that skin. We just want rejuvenation and brightening of it. So when we talk about those genes, that RNA expression that's rejuvenated, this is a very interesting kind of visual. So we have someone here that has aged and untreated skin. This is someone who has never had a broadband light therapy treatment, and then someone who's aged and treated, someone like me, and then someone like maybe my nieces or my children who are young and untreated. When you look at the young and untreated and the aged and untreated, you can see that they're completely reversed. In that aged but treated patient, you can see that it turns back on that cellular signaling. So the expression of aging skin treated with the Forever Young more closely resembles that of young, untreated skin. So treatment plans. For those under the age of 30, really we're looking at just probably brightening the skin, taking care of a couple blood vessels, taking care of maybe a few light brown spots. And that's really 1 to 2 treatments per year that we like to see you for. In that kind of middle range of aged 30 to 45, usually it's about 2 to 3 treatments a year. A lot of times we say, let's see you back every 6 months. And then you let us know if you want to come back in between. Maybe you have an event going on, like a party or a birthday or a wedding, that you really want your skin to look amazing for. And that's where we kind of pull in that additional treatment. Age 45 and over, usually it's 3 to 5 treatments a year. So we usually see these folks quarterly, and then if they need an additional treatment along the way, we can accommodate that. We can combine broadband light with skin tight or halo for a greater effect. And there's actually many different modalities that we can combine broadband light with. And we enjoy doing that because anytime we can combine treatments, we know we're going to get a better result than just with one type of modality. It's virtually pain-free. It is a little spicy, we say, because you can feel, I would say, just a little bit of snappiness to the skin, but we don't numb for it traditionally. Certainly we can if someone's incredibly sensitive, and that sometimes does happen, especially for our acne scar patients, but it's not something that we routinely do. And it's a very quick treatment. This is something you can easily do on your lunch hour, 20 to 30 minutes, in and out. After the treatment, we can always put a little bit of makeup or a little bit of Jane Iredale or tinted moisturizer on you, and you're on your way. No one will ever know that you were there getting treated with us. And there's really little to no downtime. I'm going to show you what that means further in the pictures so that you can gauge for yourself what downtime is. It's very personal for everyone. So it's difficult to gauge what one person's downtime is, and versus another's. So for me, I really don't mind putting on some tinted moisturizer and going about my day. Maybe I have a little bit of freckling, but that doesn't bother me. For someone else, it may be a reason that they want to do it on a Friday to take at least 2 days before they go back to work. It really is personalized. And then we have long-lasting results with long-term benefits with broadband light. So it's an innovative technology, and it really is setting the new standard for skin conditions associated with aging, with active lifestyles. If you are outside and you are exercising, you're biking, you're running, you're walking, you're just enjoying the sunshine outside, your skin is going to get some damage to it. Certainly we wear sunscreen and we try to mitigate that as much as possible. But this is a great way to make sure that, even though you are doing those good, diligent things, that we can continue to protect the skin from that aging process. We can treat sunspots, small veins, and many other skin conditions. So the treatment is tailored to match your skin type. Let's say you come in and you have aging skin, you have brown spots, but you also have active acne. We can treat both of those in one sitting with one treatment, which is wonderful. We can adjust the settings on the fly during the treatment to adjust to whatever it is your skin is telling us it needs. So the light energy that's delivered applies that heat to the upper layers of the skin, and we target, again, those different areas with different filters. A lot of times, this is a process. So, maybe we start with treating the acne first, and then we move on to treating the brown spots, and then we use some skin tightening at the end. So that photothermal energy can eliminate those fine lines, those vessels, that redness, the unwanted brown spots, and those pigmented lesions really beautifully. So what do we use BBL for? When someone comes in and says, what exactly does this do? What are you using it to correct? We're using it to correct sun-damaged skin, which we also call photorejuvenation. We're using it as an adjunct treatment to halo, to microneedling, skin tightening, for our chemical peels, dermal infusion, dermaplane, and the list goes on, because this is one of those treatments that's structurally really important for your skin to maintain that healthfulness. Anything we do on top of that is only going to make it better. We want to maintain healthy skin. Maybe you have done a couple halo treatments and you've been doing microneedling, you've been doing chemical peels, you have a routine that you do, and you're maintaining at home with topicals. This is kind of like your dentist appointment. So we see the dentist every 6 months, but we brush our teeth every night. We like to say come in for a broadband light treatment every 6 months and then maintain at home with your topical retinol. We use it for delayed aging. This can help delay the aging process significantly for folks. So when we talk about downtime, I love this picture because it really shows exactly what we're looking at when it comes to what type of downtime we could see. So here is a lovely young woman. She doesn't have a lot of fine lines and wrinkles, but she does have freckles and some sun damage on her skin. And so once we treat her with broadband light, you can see that these freckles darken. How long does it stay like this? Normally we see this type of darkening for approximately 3 to 10 days. We never know where you're going to be on that spectrum. Certainly, this is a patient that can put on a little bit of makeup and you're going to see a diminished appearance of those freckles, but you will see some darkening. However, she had freckles before. So this isn't going to be a huge change for those that are used to seeing her if she puts on a little makeup over it. And then you can see a couple weeks later, she has this beautiful, clear, luminous skin. So when we talk about downtime, I love showing this picture because it shows exactly what those brown spots look like when we darken them. Any brown spots that we see darken in this way, we know they're going to move up and off the skin. They don't peel. The body just releases them when it's ready. Here's another picture of a patient 3 weeks after one broadband light treatment with Dr. Teresa Mann. And I love this picture because you can really see those brown spots, those solar lentigo, the sun damaged areas. Again, not a whole lot of deep wrinkling for this patient, just kind of that dullness of the skin related to those solar lentigo or those brown spots. So here is a patient who had more sun damage on her chest. This was 12 days after her second broadband light treatment. And a lot of times for the body, when it comes to using broadband light on the chest, on the arms, on the legs, we usually like to do a corrective series of 2 to 3 treatments because we use lower energies on the skin of the body. The skin on the face reacts differently to a lot of things. And you know this because you know that your skin heals a lot more efficiently on the face than it does on the body. You see a quicker healing process on the face because of the adnexal structures. So there's different properties to the skin on the face than there are on the body that help it heal faster. So the healing process on the body is a little bit longer. So we don't want to go too aggressively. We would rather break that out into 2 or 3 treatments instead of going aggressively with one. So here's another patient. Actually, she had a series of broadband light treatments over 11 years. And you can see that her skin looks better 11 years later than it did even previously. So when we talk about that maintenance program, when we talk about clicking pause on the aging process, this is really one of the tools that are really important for that we reach for. So here you can see a blood vessel, very obviously on the side of the nose, just kind of right on the lateral part of that cheek. You can see right here where it is, and then you can see after it's treated, it just disappears. So we then went ahead and treated this vessel up here on the top of the nose. And this is a wonderful use for broadband light. A lot of us have those blood vessels that are starting to appear around the nose. And it's an area that's very difficult to cover up with makeup. So by eliminating those blood vessels and causing them to kind of collapse on themselves and just be absorbed by the body, we can eliminate those and get them to go away. Certainly, this is something where we do see those blood vessels occasionally come back. So in your maintenance treatments every 6 months, it may be something that we continue to address to keep them at bay. Here's a gentleman with rosacea and sun damage. You can see the redness on his skin, the irritation, and we were really able to, just in a couple treatments, get him looking much, much better. So this was courtesy of Dr. Frazier, this picture. And I think it's a wonderful example of how broadband light isn't just for women, it's also for men as well. Here is a patient of ours who came in with rosacea, and she has very rosy cheeks. She's a youthful, very young patient, but this bothered her. She would flush and blush quite frequently, and it was a cause of concern for her. We were able to treat her with that Broadband Light Forever Clear treatment and really get that pinkness that she was experiencing on her forehead and on her cheeks to diminish significantly. And she just looks very glowy. Her skin just really looks luminous after that treatment. Here's an acne patient that we had. Beautiful, beautiful girl. She's just, I mean, a doll. And she was actually getting harassed at school about her acne, which, you know, unfortunately, sometimes kids are just rude, and we never want to have someone who feels unconfident because they're getting harassed. But unfortunately, that sometimes is a reality for teenagers. And this was something that caused her to be very self-conscious. So when we look at her skin, we see a lot of inflammation. We definitely see a little bit of scarring from old breakouts. And then we see, you know, some new breakouts or some healing areas on the skin. And you can see afterwards, again, her skin just has that really luminous, clear appearance. So this was after a series of 8 broadband light treatments that we did for this patient. And we see her back. usually every 6 months, just for a maintenance treatment. She knows when she needs to come back to us because she starts seeing some breakouts again. And so this is a fabulous maintenance patient. We're going to be seeing her every 6 months. We're going to use our Forever Clear protocol to help combat her acne, but also she's going to get wonderful anti-aging benefits from this. Here's another patient who again has that combination of kind of redness, irritation, and sun damage. So she has some reds on her skin, but she also has some browns. And by bringing that up, we can really change the way that the skin appears, the way that the sun and the light reflects off of the skin. Certainly, she would be a candidate for additional treatments to kind of clear the rest of this up. A lot of times in the first treatment, it gets some of the more obvious issues, and then we use our second and third treatments to kind of clean up what's left over and shut down continuous blood vessels. Here's another patient of ours who's just a ray of sunshine. She's beautiful and she's funny, and she is just so fun to have in the office. We love when she comes to visit us. But she did have some freckling. She lives on the water, and so she gets out with her kids and she enjoys the sunshine. She enjoys the lake. But come fall, when everything has calmed down and school has started back up again and we start seeing some more clouds, she comes in for her broadband light treatment to maintain her skin. So you can see the way that the light reflects off of her is much different. And that's all we did in this picture was broadband light and a little bit of Botox on the forehead. So you can see some of those lines have been improved just by a little bit of muscle relaxer injected there. Here's another patient, more with vascular damage than anything. She has really nice skin, firm skin, not a lot of laxity, but she was starting to see these little blood vessels crop up that we see a lot of times with rosacea. So this was 9 weeks after her third treatment. Here's another patient, and you can see she would be a great candidate for halo because she has these deeper, fine lines and she has some textural changes in her skin. So if I had my choice with this patient, certainly we would do a broadband light treatment in addition to a halo so that we could get at these reds and browns that are showing up on her skin, but also tighten and brighten and kind of just retexture this skin right on her cheek. She had a beautiful result. And maybe someone doesn't want, to have downtime, or maybe they're new to taking care of their skin and the thought of having a laser treatment is just a little bit more than they want to investigate right now, and that's okay. So this is a wonderful treatment for anybody that has browns, reds at any age, and certainly there's other things we can add for additional improvement, but this was a wonderful result for this patient. Here's another younger patient who, again, has more of that sun-damaged brown skin. Growing up in California and Florida, we see this a lot with younger folks who've spent their formative years on the beach. She doesn't have melasma per se. She doesn't have kind of that patchy brownness on her cheeks or her upper lip or her forehead. So that's not what we're dealing with here. It's not a hormonal fluctuation that's causing her pigment. It's more sun damage. And you can see how much more youthful she looks once we can clear that up. It's really a beautiful result. Again, another patient, this one from Australia. So she really has lived her life on the beach, and she has, the brown spots to show for it. And truly, she doesn't have a lot of laxity. She doesn't have a lot of fine lines or wrinkles. It's just that damaged skin that's keeping her from looking and feeling her best. Here's another patient who had a combination of broadband light and halo. So this is a combo treatment for this patient. She had significant acne scarring. She had a lot of sun damage, and the texture of her skin was very, very rough. It almost seemed like she had a layer of tough skin laying on this beautiful skin underneath. And so she'd had acne in her past as a teenager, and she still carried those scars with her, which just really made her feel unconfident. And so we were able to use broadband light as well as halo to bring up these brown spots, diminish this redness, and really retexturize her skin. Here's a patient that was treated just with broadband light. Again, fabulous skin, just really has quite a bit of damage. And we do see this on quite a few folks. So if this kind of damage in these brown spots and this freckling is speaking to you, a lot of times there's two different types of freckles, those that we get because they're genetic and they're adorable and they're just, it is who we are. And then there's freckling that comes from sun damage. So with broadband light, a lot of times we are going after those freckles that are caused by sun damage. Certainly we can diminish some of those other freckles as well, but when it comes to that sun damaged skin, that's really what we're going after. So this is the end of our presentation. Thank you so very much for coming. Again, if you have any questions, please reach out to us. My email is Erin, ERIN, at blushnwo.com, or you can always call us at 419-520-7546. We can also receive text messages at that number. So any questions, or if you feel like this is a treatment that you could benefit from, give us a call, email us. We're happy to get you in for an appointment. Have a great day, everyone, and we hope to see you soon.